Hey, everybody. I'm excited to join you tonight. Thanks for tuning in. I think tonight's topic is going to be very interesting. It's definitely one that I think has probably touched some lives on here, maybe everyone's life. As you knew, the topic tonight was going to be about brain health, but I decided to kind of narrow it down more specifically to neurodegenerative diseases and especially Alzheimer's disease. So would love to know of those tuning in tonight, how many have been touched personally by experiencing Alzheimer's disease in your family, friend, loved one. I would be willing to bet that most of you have, or maybe all of you have in some form or fashion. So with it being the sixth leading cause of death here in the US, it's something that we probably don't talk about enough. And so we're going to dive in. I'm going to share some slides with you. Hopefully we will get that to cooperate with us here, and we will get started. So first off, we always have to cover this important information. The following information is not intended to replace a professional medical recommendation. It is only for informational and educational purposes. If you have any of the following symptoms, you should consult a licensed healthcare professional for the diagnosis and treatment of any medical condition. All right. Alzheimer's disease, of course, is a very specific neurodegenerative condition. Many people compare it to dementia. Of course, it has symptoms as such, but dementia is a general term, right? There's many different things that can cause a reduction in cognitive function, and not all of those are Alzheimer's, right? Alzheimer's is a form of dementia, but not all dementia is Alzheimer's disease. And we're going to talk about some specifics of Alzheimer's disease. First of all, the prevalence here in the United States, 5.8 million people currently suffering with Alzheimer's disease. And it is actually 1 in 10 of those age 65 and older. And it's nearly 1 in 3 of those 85 and older. And as you see here, the estimation over the next 30 years, by 2030, they expect to be 8.4 million, by 2040, 11.6 million, and by 2050, 13.8 million. And a lot of that is due to our aging baby boomer generation, right? As you can see, this purple gap here continues to get bigger and bigger and bigger, and those are the ages 85 and older. All right, this is lifetime risk. If you're 45 already, there's a 10% chance if you're male that you will develop Alzheimer's disease, 19.5% if you're female. If you're already 65 years of age, there's an 11.6 chance as a male that you will develop Alzheimer's disease, and 21% if you are female. And the difference there, although they're still studying that, one of the main differences in the female to male ratio is females tend to live longer than males, right? And this disease, especially, the longer you live, there is a significant increase in the risk that you can develop Alzheimer's disease, right? And so cost of healthcare, long-term care, 305 billion. One thing I thought was shocking is that if you are the caregiver of someone with Alzheimer's disease, it's expected to be $50,000 per year out-of-pocket expenses. That's just devastating. Already, 1 in 10 over 65 have Alzheimer's disease, the sixth leading cause of death in the US. 5.8 million people in the US who live with Alzheimer's disease. One thing that's pretty shocking is that you could have Alzheimer's for 20 years prior to symptoms developing. That is shocking. And 2/3 of the patients with Alzheimer's are women. All right, here, this is just showing the leading causes of death. Alzheimer's here is number 6 behind heart disease, cancer, respiratory diseases, stroke, accidents, and Alzheimer's disease, followed closely behind by diabetes, of course, which we just covered a few weeks ago. All right, early signs. Memory loss, forgetting recent events, names, conversations, misplacing items, difficulty completing tasks, having trouble with cooking or driving or using a phone or paying the bills, or something they might do regularly, like shaving or combing their hair, mood and personality changes, becoming more anxious, aggressive, depressed, feeling suspicious. And this is a cross-section of a healthy brain, what a healthy brain would look like. This is an advanced Alzheimer's brain. One of the things we see is the cortex of the brain shrivels up, and this is an area involved in thinking and planning and remembering. It is especially severe in the area called the hippocampus, which is a part of the cortex that plays a role in formation of new memories. We also see this ventricles here, these dark areas, which are here on the healthy brain, much larger here on the Alzheimer's brain are the ventricles, and these are fluid-filled spaces. These grow much larger. Here's a PET scan of a normal brain, mild cognitive impairment versus Alzheimer's disease. Can you tell a big difference between especially the one on the left and the one on the right? In being a functional medicine doctor, I'm always interested in finding root causes and rather than just treating symptoms, but actually seeing what some of the underlying causes or triggers might be. And we're going to talk just about a few. There's many, but we're going to talk about a few of the more common possible root causes. One of those we're going to start with would be diabetes, followed by we're going to talk about leaky gut and leaky brain. We're going to talk about aluminum toxicity, and finally we're going to wrap up with inflammation. The shocking thing is that if you have diabetes, there's a 60% increased risk that you will develop Alzheimer's disease. In fact, they are calling Alzheimer's disease now type 3 diabetes. Isn't that interesting? And not only that, but the longer you have diabetes, the greater the increased risk, right? If you were, let's say you're 70 years old and you develop diabetes, there's about an 11% risk that you might go on to develop Alzheimer's disease. But let's say you get diabetes at 60 years old, just 10 years younger, it's up to 77% risk that you're going to develop Alzheimer's disease, right? And the reason behind this all boils down to insulin resistance, okay? Here they talk about this image, why Alzheimer's disease is called type 3 diabetes. The brain is on fire. And indeed, the brain is on fire. A lot of inflammation, neuroinflammation going on. And one of the causes is insulin resistance, right? So, normally when we consume sugar, our blood sugar will go up as a response to that. Our pancreas gets involved, right? It secretes the insulin, which has the key to unlock our cells in our organs, our muscles, our tissues, unlocks the cell and allows that sugar to come into the cell, out of the bloodstream. And then, of course, our cells use that glucose to make energy. Well, in insulin resistance, what happens is that mechanism starts to become dysfunctional. It sees more and more sugar, more and more insulin, and the cells, they're not paying attention to that insulin as they once did. It's not as effective as it once was. Those cells become resistant to it. So it's kind of like the boy who cried wolf, right? The cells are like, oh, whoopee, big deal, more insulin, right? And so they're not paying attention to that insulin as readily as it used to be. And so now it requires more insulin to get the same response. So we see a little bit more insulin, the cells become a little more resistant, that blood sugar starts to increase a little bit. Regardless of the insulin, the pancreas says, well, maybe I just need to yell a little louder, right? So it cranks out a little bit more insulin. And as a result, the cells start to become even resistant to that. This goes back and forth until we get to the point that although there's lots of insulin in the bloodstream and present, it's no longer able to control the blood sugar or get that sugar into the cells that are badly needing it to create energy. Well, guess what? Our brain is the largest consumer by far of any organ of our body of sugar. And guess what happens to brain cells that become so insulin resistant that they can't get sugar inside for fuel? They die, right? This causes cell death, and this creates a large amount of inflammation. And this is the reason that they call diabetes they call Alzheimer's disease type 3 diabetes. Talk a little bit about leaky gut and leaky brain. That probably seems far-fetched that our gut could be connected to something like Alzheimer's disease, but I'm going to share with you just a little bit about how that can happen. And so if you're not familiar with leaky gut, what happens? This is a cross-section here of our intestinal barrier, okay? These are the intestinal cells. This is where our food comes along through here, okay? Can you guys see my cursor moving, or is that only me seeing that? Okay. And so we have these little villi here is where we absorb our vitamins and minerals and nutrients, right? And these cells right here, where they come together, they come up against each other. They call this a tight junction. So there's a lot of things that cause stress on that intestinal lining. It could be something like gliadin, which is a protein in wheat or gluten, right? There can be a myriad of toxins we're exposed to, and chemicals, and medications, and things that take their toll on this intestinal barrier. What this happens when we have stress on this intestinal barrier, it causes a release of a protein called zonulin. If you can see that right there, I don't know if it's big enough, but this protein called zonulin, what it does is it opens up that tight junction, right? It relaxes that tight junction. And if there's a lot of it, it causes a large gap right here in these tight junctions. Well, then things that shouldn't be in there start to be able to pass through this intestinal barrier, okay? Things like antigens and foreign proteins and pathogens, which are, bacteria and virus and yeast and things like this, toxins, bacterial lipopolysaccharides, inflammatory chemicals, suddenly start to pass through this intestinal barrier. Can you see why they call it leaky now, right? Does that make sense? So this is the leaky part of our leaky gut. This starts to get into our bloodstream, which is on the other side of that intestinal lining, okay? And this causes a lot of problems in our vascular system, increasing inflammation and causing irritation and etc. But what this does is it carries this up into another barrier that's very important to us called the blood-brain barrier. And guess what? These cells look an awful lot like these cells, don't they? Right? They don't have the villi like our intestinal cells, but guess what? They also have this tight junction. And guess what also opens up the tight junction in the blood-brain barrier? That same protein called zonulin. Okay. And so here we have this leaky gut that's out of control, causing all of this inflammation and this immune response, this immune dysfunction, could be a driving factor for autoimmune disease. And now it's getting into the circulation, it's going up and it's causing an opening up. Not only we now have leaky gut, we now have leaky brain. This is creating an inflammation, it's causing immune response, free radical generation in the brain, leading to neuroinflammation or inflammation of the brain, okay? This could be a driving force for the inflammation associated with Alzheimer's disease. So aluminum, this is something I think isn't talked about enough. This journal article here talks about how aluminum contributes to the pathogenesis of Alzheimer's disease. It is co-located with the phosphorylated tau protein present in the tangles within the neurons. So they're seeing aluminum in these areas of this tau protein aggregation in these tangles in the brain of Alzheimer's patients. Well, where does too much aluminum come from? Okay, here's a list of a lot of places that we can get extra aluminum from. We can get it through antiperspirants. I think this is largely where we could avoid this, right? If we're careful with our hygiene products and not use aluminum-based antiperspirants, which is most of those on the shelf, right? If it says antiperspirant, you can almost guarantee it's full of aluminum. Well, guess where one of the places we absorb things quite rapidly into our bloodstream and into our lymph system, right? Right under here. And we're putting aluminum right there, right? Don't get me started. I don't want to get on the soapbox here, but aluminum pots and pans, we can cook in aluminum. We can use canned goods that are, of course, aluminum. Aluminum foil. People can cook in aluminum foil, and that could be a source. Municipal water can actually have aluminum in there. Vaccines contain aluminum. Baking powder has aluminum, and cosmetics. And it's usually not one source, right? But it's a conglomeration of exposure over time, over a lifetime sometimes, that can lead to this accumulation of aluminum in the brain. So I'm going to talk about some action steps here to improve brain health. Some of these will be pretty obvious. Others I think will be helpful, but an anti-inflammatory nutrition plan, right? We need to reverse this blood sugar dysregulation. 1 in 3 have pre-diabetes or insulin resistance, right? We talked about that last time. So we need to reverse this blood sugar situation. We've got to keep our cells responsive to the insulin, right? We've got to reduce and eliminate that insulin resistance in our body and especially in our brain. Reducing stress. I think we could all use a lesson here, right? Improving sleep, reducing toxins in our food, toxins in our cleaning products, in our hygiene products, in our plastics. A good either eating or supplementing with good healthy fats, right? Those omega-3 fats. Intermittent fasting is shown great benefit for the brain. Optimizing vitamin D levels is helpful for the brain. Supporting a healthy gut. We talked about the gut and the brain. We've talked about that before as well. I'm going to put a plug in there for some BioFi as part of that gut health protocol. Moving your body, and of course, we have to talk about curcumin. Inflammation is the driver. We've talked about several areas that's causing inflammation, and inflammation is causing a lot of damage. In medical news today, targeting early brain inflammation may slow down Alzheimer's disease. And so this is a brain inflammation and look between a healthy young brain, a healthy elderly brain, and an Alzheimer's brain. You see the areas of red that are lit up. This is inflammation. Okay, does that make sense? So other conditions associated with brain inflammation, we've focused here tonight, of course, on Alzheimer's, but there's a lot of conditions that are actually tied in with brain inflammation. Depression, anxiety can be related with neuroinflammation, premature aging, ADD, ADHD, brain fog, schizophrenia, bipolar, and even autism can have roots in brain inflammation. We're going to focus now on curcumin, one of my favorite tools, as you well know. And the literature is just full of studies on curcumin and Alzheimer's disease. I mean, full of studies. I just handpicked a few. The effect of curcumin on cognition and Alzheimer's disease and healthy aging. This review here on curcumin and Alzheimer's disease. Examining the potential clinical value of curcumin in the prevention and diagnosis of Alzheimer's disease. This other one, dietary supplementation with curcumin reduces circulating levels of glycogen synthase kinase, amyloid polypeptide. So the amyloid is what's famous for creating those plaques in the brain, right, of Alzheimer's patients. Curcumin can reduce that plaque formation, and this was especially also in type 2 diabetics. And this is just a few of those ways that can help. Is the tau proteins become what they call hyperphosphorylated, and this changes the structure of the tau protein to now become toxic to our neurons. This inhibits that from happening. Curcumin inhibits this. It's anti-amyloidogenic. I'm not sure if I pronounced that right, but it sounds good. And it inhibits that amyloid aggregation, that plaque aggregation in the brain. It's neuroprotective. It promotes neuroplasticity. It's an antioxidant. It reduces that oxidative stress in the brain. It, of course, is a major anti-inflammatory. It enhances this beta phagocytosis by the microglia. So those brain cells, it helps them to gobble up. That phagocytosis means to gobble up that beta plaquing in the brain, like Pac-Man. And it inhibits inflammation as well. All right, let's see here. The protective effects of the Indian spice curcumin against amyloid beta and Alzheimer's disease. Just going to go down here a little bit. Curcumin prevents the beta aggregation and crosses the blood-brain barrier. This is something we don't talk about enough. Curcumin is one of the very few substances that actually has been shown to cross the blood-brain barrier. And that's pretty exciting when we're dealing with inflammation inside the brain, right? It reaches brain cells, protects neurons from various toxic insults of aging and amyloid beta in humans. Recent research has also reported that curcumin ameliorates cognitive decline and improves synaptic function in mouse models of Alzheimer's disease. And let's move over here. Curcumin inhibits the formation and promotes the disaggregation of the amyloid beta plaques. It attenuates the hyperphosphorylation of that tau, hyperphosphorylation of the tau proteins. It enhances its clearance It binds copper, it lowers cholesterol, it modifies microglial activity, right? It helps it to gobble up that plaque. It inhibits acetylcholinesterase, mediates the insulin signaling pathway, right, with insulin resistance, and is an antioxidant. In conclusion, curcumin has the potential to be more efficacious than current treatments. Wow, that's a powerful statement. Curcumin has the potential to be more efficacious than current treatments. Now read the next sentence. However, its usefulness as a therapeutic agent may be hindered by its low bioavailability. Have we heard that before, right? And let's move on to that, what we call the hidden secret, right? If you've seen me before, I talk about this often. The hidden secret about curcumin is it's very poorly bioavailable. And that's been a struggle that scientists have dealt with for a very long time as they've studied curcumin and knew it had all these magical properties, but could not get it into the body at sufficient levels. So what percent do you believe of curcumin that you ingest is actually absorbed at the intestinal level? Those are your choices: less than 10%, 20%, 50%, more than 50, and it's actually less than 10% is absorbed. And some would argue much less than 10%. If we're talking about turmeric, right? We hear about turmeric root. Of course, curcumin is only about 5% of that turmeric root. Okay, there's only a little bit of curcumin in turmeric root, and it's a lot of other things besides curcumin. And so it takes 500 milligrams of turmeric to get 1 milligram of curcumin in the bloodstream. Okay, that's a lot of turmeric to try to get the curcumin into the bloodstream. And of course, if you go into PubMed and you look at curcumin articles at all, and the research and the studies, it all talks about this, just like the original article that I pointed out, it is poorly bioavailable. I found this interesting. Despite these positive effects, a major criticism of curcumin is its poor bioavailability. In fact, some researchers have argued that given its unstable, reactive, non-bioavailable nature, that further clinical studies of curcumin are unwarranted. So these scientists are saying we just need to quit studying this stuff because we can't even get it in the body, right? It's been confirmed to exhibit very poor bioavailability, with many studies showing very low or even undetectable concentrations in the blood and extraintestinal tissues. Major reasons are due to its poor absorption, rapid metabolism. That means it's broken down, right, too quickly, its chemical instability, and its rapid systemic elimination, which of course means our body just excretes it pretty quickly. And so this has been a problem, of course. So we're trying to get something that has very many therapeutic benefits into the body, and we can't do that. One of the reasons is because curcumin and turmeric are what they call hydrophobic, meaning they're afraid of water. And that's a problem when our body, our cells, our bloodstream, right, is mostly made of water. And this is another article of a scientist. This was only back in 2017 that was ready just to throw up his hands with studying curcumin. He says, so what do you get when you look closely at the molecule and its activities? Well, for one thing, curcumin stability and pharmacokinetics are absolutely terrible. It's less than 1% bioavailable, and its half-life under physiological conditions is measured in minutes. Much effort and funding has been wasted on curcumin research, says the scientist. And so you can just sense the frustration that he has had in studying curcumin and probably hitting his head against the wall of trying to get this into the body and not even able to get it into the body at levels where they could find it in the bloodstream. And that's until our amazing bioms technology, right? I often say that it's changed everything that we thought we knew about curcumin and has definitely disrupted the nutritional industry. We're going to talk about why that is. It is a multi-patented product. Bioms stands for biotechnology with mycelial solubilizates. Surprised that this Missouri boy can even pronounce that. But it's 277 times, up to 277 times more bioavailable than standard curcumin alone. And I like this visual because it shows here the little curcumin component in here, this little nanoparticle, less than 30 nanometers in size total. And this particle right here is what they call hydrophobic, right? It's afraid of water. It loves fat, but it hates water. This is part of that technology, right? Is the mycel technology. This is wrapped in a mycel structure. Well, guess what? This mycel can easily carry that curcumin into the bloodstream, can easily deliver it through that intestinal barrier, and can easily get it into our cells, our organs, our tissue, and guess what? Our brain. This little bottle right here is powerful, right? We're talking about 10 drops of this amazing technology, up to 277 times more bioavailable, which would require up to 17 pounds of turmeric root consumption to equal those 10 drops, or 25 plus capsules of curcumin to try to come close to those levels. And when we talk about that technology and we talk about nanotechnology, really that's just talking about really tiny particle sizes, right? And this is how tiny we're talking about is the particle sizes with the bioms is less than 30 nanometers. So our red blood cells you can see here is 7,000 nanometers wide. A human hair, we'd have to slice it 100,000 times to get equal 1 nanometer. One of those 100,000 slices of that hair would be the size of a nanometer. So that's how tiny of particle sizes that we're talking about. And so this is exactly why that scientist was ready to throw up his hands with any curcumin research in the future, is probably because of studies like this. So this particular study, they gave the human subject 2,000 milligrams of curcumin, and then they measured the curcumin concentration in the blood right here over time right here. And I always joke that you'll have to lean in closer to see the peak here of curcumin. At about an hour, we can barely see a little blip of curcumin in the bloodstream, right? And we had to catch it at that very quick moment in time to see that, and look where it's at by 2 hours. It's completely undetectable in the bloodstream. Does this look like this would be a very therapeutic substance, right? If we could get it in the bloodstream for maybe 2 hours, if we're lucky, and we peak here at hardly any levels at all. And so when we talk about, we hear this a lot of times, I hear this a lot anyway, well, my curcumin contains black pepper extract, right? Which fixes the bioavailability issue. Well, not so fast. It actually doesn't. Now, I would agree this peak here does look a little more exciting than this peak down here. But this is about 45 minutes. We see a peak with black pepper extract, right? And we quickly follow that within the next 15 minutes. We're back down to here. All right. By 2 hours, we're here. By 3 hours, we're undetectable again. So we get a brief rise of curcumin with black pepper extract by slowing down liver detoxification, right? We know that curcumin is rapidly metabolized by the liver, rapidly excreted. So black pepper extract briefly slows down liver detoxification, allowing a very brief peak in curcumin in the bloodstream, followed by a rapid excretion metabolism after that. My issue with that is that many people that might use curcumin are probably taking other prescription drugs as well, and probably other supplements as well. Are we influencing these medications by using black pepper extract to slow down liver detoxification? That's a big question mark in my book. These are the levels that we're seeing with our technology. Not only are we reaching levels in the bloodstream that we've never seen before, not even close, and that is super exciting, but remember how quick the body excreted those earlier samples by 2 hours if it was standard curcumin, by 3 hours if it was adding a little black pepper extract. Look at this, 4 hours, 8 hours, 12 hours, 16 hours, 24 hours. There's still measurable amounts of curcumin in the bloodstream from a single 10-drop dose. Now, guys, that is terribly exciting that we're able to achieve that with this technology. Not only levels we've never achieved in the bloodstream, but we've never seen the ability to maintain curcumin in the bloodstream with this length of time. And this is exactly why we're seeing lives changed. We're seeing health restored, and we're seeing all of the amazing benefits with this technology, is because we're finally able to get this magical substance, this curcumin, into the body at therapeutic levels, and being able to maintain that over a period of time, which allows amazing healing potential. And so, of course, it's not about how much curcumin you take, but how much is absorbed, how long it stays in your bloodstream, in your organs and your tissues. And like I always like to end with an image. We have native curcumin extract added to water. Can you tell that this is afraid of water right here, right? That is the definition of hydrophobic. And then we add in our amazing BioS curcumin, which is completely soluble in water, completely soluble in our bloodstream, able to easily get in and get into our cells, our organs, our tissues, and tonight's importance, our brain. And so I'm going to wrap that up. I'm going to pass it back over to Dave or Tyler, and hope that was helpful.
No, that's just absolutely incredible. I wondered real quick before I have a couple of comments to make about this, if you would be willing to take any questions, Dr. Thornton.
Absolutely.
Okay, all right. If you do have some questions, we would ask you, we'll take up to maybe 5 questions. I know that we're kind of limited on time, but let's take up to 5 questions. If you do have some questions, please go ahead and type them in the chat, if you would, and then we can get to those questions straight away, and then Dr. Thornton hopefully can have a chance to be able to answer those. But if you'd like to ask a question, please type it in the chat. This is just absolutely incredible information, and it's obviously a very an important, significant topic by the number of people that we have on, that are watching and listening right now. And I know that we'll be paying attention to the recording for sure. It's interesting. You talk about how it's type 3 diabetes, the inflammation of the brain. You talked about causes and conditions. And but one of the things that I love that you shared, Dr. Thornton, is all the science behind, the people that are, it's not just us, sharing different things about Alzheimer's or dementia, and what curcumin can do for it, but it's the science. And I really appreciate you taking the time to be able to do the research and to be able to share that with us, because that makes such a big difference to know that you said that there was hundreds and thousands of articles about what curcumin can do for brain health, specifically with Alzheimer's. And that's just a big thing. My grandmother passed away from Alzheimer's back in 1989, 30-something years ago. And you said it a few minutes ago that everyone is affected one way or another by somebody that they know that has dementia or that has Alzheimer's as well. And I thought it was kind of interesting too, and then we'll get to the questions about how so many scientists have done the studies on curcumin, but that they're giving up. And they're like, why are we wasting our time on it? Why do we even want to pay attention to it anymore? Because it's not bioavailable. And of course, our product is, and how you talked about that and the studies and the research, that you've done on that. So that was just amazing. That was incredible. I really appreciate that. It certainly came alive to me. It is very much, because of what my experience, was, when I was a kid, watching my grandmother go through this, and everybody, how it's affected everyone. And so many of you have experienced that and watched family members go through that as well. So thank you so much for taking the time.
You're welcome. One of the things, Tyler, that I've been blessed with good health, and one of the many reasons that I use curcumin every single day, and I don't believe I've missed a day. If I have, I could count it on one hand the days that I've missed curcumin in the 3 years that I've been taking this product. If nothing else, prevention, right? The things that we can do, if we can control inflammation in our life, and we can control inflammation on our body, the things that we're protecting our bodies from, the health, complications, that's powerful, right? And
absolutely. So we have a few questions in the chat, and we'll just kind of go by order in which they came in. But Daniela, she's asking, dosage for brain health, you still recommend only 10 drops. But if you experience or sense some signs of brain fog and some symptoms of deteriorating brain health, you take a little bit more. What would you say?
Yeah, for most of my patients, we're generally using 10 drops. Now, if it's somebody that is actually in the throes of neurodegenerative type conditions, we might be using 10 drops twice a day. And rarely do I see need for higher than that. But again, if it's, typical, I've seen improvements in everything from brain fog to concentration to even things like anxiety and depression. I've seen improvements with just simply 10 drops a day. But more serious, complicated issues, or maybe somebody that's dealing with issues for a longer period of time, might take slightly higher levels.
Okay, that's great. No, I appreciate you answering that. One thing that I think was kind of interesting is Haiti has asked a question. are we as laymen allowed to talk about this subject without trespassing the claims? And what I loved what you did, Dr. Thornton, and how you went through this is that Alzheimer's is such a significant topic. But you talked about the what Alzheimer's is, then you talked about the science behind it, you talked about the conditions and some of the causes that are there. But not once did you say, not even one time did you say that our product will cure it, our product will prevent it, our product will do this or that. Curcumin, however, with the science that you shared, has had a significant impact on Alzheimer's. And then you talked about the bioavailability of our product. So I think that without trespassing claims, Haiti, as you talked about, the way that Dr. Thornton just presented it is absolutely spot on with that. So I appreciate the way that you said that. So, and then Shelley says, did you say the black pepper affects the absorption of other medications?
Yeah, and actually it can. What it does is it briefly slows down what they call phase 2 of liver detoxification. And so we briefly slow down that phase of liver detoxification. My issue with using this, especially on a daily basis, or some people are using it multiple times a day in their supplements, is how are we impacting the other medications that they might be on, right? And we have such a better answer than we used to, right? That used to be even just a few years ago was the gold standard, is you had to take curcumin with black pepper extract, or you might as well flush it down the toilet, right? That was about the cinnamon on it. And then, some newer technology came out, things with liposomal technologies and different things that improved absorption a little bit more. But we've not seen anything that has come close to this nano mycelized bioms curcumin.
Eileen says something kind of interesting, and I want to be able to answer this. She talks about taking 10 drops 3 times a day for 4 months because of chronic pain. Her brain fog is listed, and she can focus now, which is great. However, the body pain has not improved at all. Any idea how I can get the pain relief others have experienced? I can speak to that from a personal standpoint, because I have been taking the product very consistently, even up to a couple times a day, for the past 3, maybe 3.5 to 4 months, actually. Every single day. Like you said, you don't miss a dose, and I'm not missing any. And I have so much inflammation in my body that it's taking time. And yes, my brain fog is lifted as well. And I can see so many other different aspects of what the product has done for me. But I can sense slowly but surely, because of the levels of inflammation that I have personally in my body, that it's working. I can start to see it on a slowly but surely kind of a basis. I have we do a lot of walking, with the things that we're doing with Vitify, going to different places, and I have a difficult time with my knees. But over time, and it hasn't happened overnight, but over time, because of the amount of inflammation that I have, I'm starting to see and feel a little bit of a difference, that chronic pain that I'm experiencing is going away, is dissipating a little bit, as well as the significant other aspects that the product is helping me with. And so I love that. And so just, Eileen, if I can just say anything, keep doing it, because you're going to be able to see some of that chronic pain lift because of the reduction of the inflammation, which our product specifically does. And you'll get there, I promise.
Yeah. And Tyler, let me share one thing real quick about that. One thing that I've seen is I have had a few patients where it took longer, a little longer to see some of the benefits that they were focused on, right? And usually that was physical pain or inflammation or joint pain. And I've heard multiple times after they believed, they thought to themselves that maybe this just isn't working for me. And they stopped taking it, right? Because they thought maybe it just wasn't working for them, and suddenly realized that it was helping their inflammation, right? That their pain level was improved a great deal, but it was so slow that they hadn't realized it until they stopped taking the curcumin. Then they realized, hey, this was helping. I just didn't realize how much until I stopped taking it. And I often tell people too, there's a lot of things going on in our bodies, especially us that have, been here 40, 50 years or more. There's a lot of things, a lot of wear and tear, a lot of inflammation, a lot of things that the body is in need of repair, and many things that we don't know and probably will never know. And I always encourage people to realize that our body has its own healing priority list, right? And that healing priority list isn't necessarily our priority list, right? We have the top list of what we want to see this do, and in the order we want to see that happen. But guess what? We don't get to choose that. Our body knows what's best and what needs the attention, what needs the healing, what needs the repair. And so I just encourage you to hang in there. Your body's doing great things with this amazing technology. It just may not be in the order that you expected it to happen.
Yeah, that's exactly right. Dr. Thornton, thank you so much. We really appreciate you taking the time to research, sharing this information with us. It's critical. Obviously, like I said, it's so important and touches so many people's lives because of the number of people that we have on here tonight. And we certainly appreciate all that you're doing. So thanks everyone for being with us this evening. Everyone have a great day for the rest of your day, a wonderful evening. And thank you. We'll talk to you next time. Thanks everyone.